My name is Jennifer Sposito, and I'm the Chief of the Department of Anesthesiology at the Hospital of Central Connecticut.
What do you like most about IAA?
Some of the things that I like most about IAA are my colleagues. We have a great group of physicians that work here and work collaboratively together, knowledgeable and dependable colleagues. And I also really like the philosophy of IAA, and that's something that was really important to me when I was choosing a practice. It was important to me that that matched my clinical practice, and there really is a great focus on clinical excellence here, as well as quality and safe patient care. So those things were important to me when choosing IAA.
What is the clinical environment like at IAA?
The clinical environment at IAA, we have variable environments depending on where you practice. So hospitals, surgery centers, GI endoscopy centers, there's lots of different places, but everywhere that I've practiced has been collaborative environment with our clinical members as well as with our colleagues outside of anesthesia, and also clinically progressive. So IAA supports colleagues bringing new ideas, integrating evidence-based medicine into our practice, obtaining new equipment that's cutting edge so that we really can provide the best patient care.
How do you manage work-life balance?
So one of the things I like about IAA is we are a large practice. So that may seem intimidating at first, but that size does afford some flexibility in terms of scheduling and making adjustments to your schedule. You have a lot of colleagues that can work with you to help accommodate your schedule needs if needed. And also we have a very predictable call schedule. So it allows you to schedule your life around your call schedule and work schedule so you can have those opportunities to have time with family. And there is a focus and emphasis at IAA in achieving that work-life balance and putting a priority on spending time with your loved ones and having that time. And this area in particular is great for that. We have proximity to New York City, Boston, a lot of things to do, as well as recreational activities, both in Connecticut and nearby in New Hampshire and Vermont. So there's plenty to do, and there's time to do it.
Is IAA an academic or non-academic institution?
I would consider IAA to be a hybrid practice. We are a large private practice with educational missions, and we're involved in teaching anesthesia fellows, anesthesia residents, student nurse anesthetists, medical students, and even paramedic students. So certainly there are opportunities to be involved with teaching if that's something that interests you. And in addition, we have research projects ongoing in various areas that you can be involved with as well.
Does IAA offer leadership opportunities?
There are leadership opportunities within IAA. And our group is very supportive and offers mentorship for those types of positions. And there's all sorts of different opportunities for leadership, whether it be clinically, in research areas, with education, or in hospital-based committees. There are plenty of ways that you can work outside of the clinical environment and participate in IAA's organization.
Why IAA?
Why IAA? There's many different reasons. But for me, one important thing is the location. Connecticut's a great place to live and raise a family. And then IAA as an organization offers a lot of flexibility as well as stability, being a large private practice, and also opportunity to grow clinically. So there are many different clinical environments where you can practice and find your niche and grow as a clinician.